Hi, future RNs. Ready ka na ba for another NLE tricky question? Today's topic is about maternal and child nursing, specifically birth plans. Isa ito sa mga madalas lumabas sa board exam, kaya make sure alam mo ang tamang concept bago ka mag-take ng NLE. Here's the question. Every pregnant woman preparing for labor and delivery has a birth plan. What is the primary objective of a birth plan? A. The cultural and religious requirement related to care of mother and newborn. B. Her psychosocial data that is necessary in her hospitalization. C. The repertoire of comfort and relaxation measures. D. Options on her wishes and preferences about her labor. Delivery and puerperium. Short pause. Think carefully. Ano sa tingin mo ang best answer dito? The correct answer is letter D. Options on her wishes and preferences about her labor, delivery, and puerperium. Tama ang letter D because a birth plan is a written outline of the mother's preferences and wishes before, during, and after childbirth. Ito ay ginagawa with her healthcare team para ma-ensure na her care aligns with her values, choices, and expectations, gaya ng kung sino gusto niyang kasama sa delivery, anong birthing position, pain relief options, at breastfeeding preferences. Sa nursing practice, this promotes patient autonomy and family-centered care, emphasized sa maternal and child health nursing standards. Ang nurse ang gumagabay para ma-communicate clearly ang plan between the woman, her partner, and the healthcare team. Option A. The cultural and religious requirement related to care of mother and newborn. Mali, that's only one factor that may influence the plan, pero not its main purpose. Option B. Her psychosocial data that is necessary in her hospitalization. Nope, that belongs to the nursing admission assessment, not the birth plan. Option C. The repertoire of comfort and relaxation measures, partly related pero limited. The birth plan covers more than just comfort measures. It reflects her total care preferences for labor, delivery, and postpartum. Key point. A birth plan expresses the mother's choices and preferences for her childbirth experience. Mnemonic tip. Birth, be informed regarding the health plan. It's all about communication and shared decision-making. If you learned something new today, don't forget to like, share, and subscribe to RN Masterclass Philippines, your daily NLE review buddy para maging next level RN ka.